My name is Sophia Marco-Georges, and today I'm going to be talking about the yellow fever virus. So the disease pathology. The structure, it is an enveloped, positive sense, single-stranded RNA virus that belongs to the genus Flavivirus. There are two different types of yellow fever, urban and sylvan. Urban yellow fever is spread from person to person by the Aedes mosquito, and the sylvan yellow fever is a virus spread from monkeys to people by the Haemogeus mosquito. The virulence is about moderate. It'll cause backaches, chills, fevers, nausea, weakness, and in more severe cases, internal bleeding, jaundice, which is yellow discoloration of the skin, and organ failure. The toxicities. Because it can only be spread from mosquito to person and not person to person, it's not particularly toxic compared to other viruses that can be spread by airborne purposes. So here I have some pictures. The first picture is the structure of the virus. It's enveloped and it's an RNA virus. This picture right here shows that the yellow fever is spread by mosquitoes. And then this picture right here shows some symptoms that a patient may have if they contract yellow fever. Some minor symptoms may include fever, a low-grade fever, vomiting, back pain, headache, and then in more severe cases it will be internal bleeding and jaundice. Disease pathology continue. So it will interfere with normal pathophysiology by inserting itself into the genetic material of the host, taking control over its normal physiological functions. And how it's spread by the mosquito. It'll enter through the skin, and then it'll travel to the regional lymph nodes where it occurred, which will then travel throughout the bloodstream. And in most cases, the first place that it will attack is the liver, which is why jaundice happens, because it's the buildup of bile. And I talk about that later in the presentation. So the infected cell then produces more viral proteins and genetic material instead of its normal products, which causes the body to be deprived of the key nutrients and hormones it needs to survive. And that will lead to, of course, increased body temperature, chills, back pain, and nausea. Then right here is a picture of how jaundice will occur. It's the buildup of bile in the liver. And then this man right here has jaundice. He has yellow discoloration of his eyes and, of course, of his skin. So the population's affected. It'll affect mostly people in South America and Africa, because those are the regions that have a lot of rainforests where the mosquitoes reside. So 80% of the cases are in males around the ages of 15 to 35, because they're exposed to the mosquitoes that live in the rainforest whenever they have jobs, maybe like construction workers getting food for the family, stuff like that. The highest cases will occur between December and May, which is it'll start to get warmer and then the mosquitoes will come out. And it will occur most often in patients of low socioeconomic status because of the inadequate housing to prevent mosquitoes from spreading the disease. And then the most important, they do not have access to the yellow fever vaccine. That is the most important preventative measure to prevent yellow fever. The significance on the community. Because it predominantly affects males in developing countries, this can negatively impact the families by stripping away the main provider of the family. For example, in 1980, the reported number of yellow fever infections was noted to be about 20 to 40% of the population. Severe cases was about 3 to 5%, and the fatality rate was about 20 to 30% in Africa. So here I have two pictures of the main regions that it will affect. So right here is of Africa, of course, where the rainforests are, and then South America where rainforests are. And it will mainly occur in these regions right here because it is warm and all of the rainforests that it has. So disease management. There are no known medications to get rid of yellow fever because it is a virus, and a virus cannot be treated with antibiotics. So the CDC does recommend a few things to help decrease the pain if a patient does get yellow fever. So they recommend to drink plenty of fluids, rest, and use pain relievers to reduce fever and to minimize aching. And to also avoid medications that are used for anti-inflammatory purposes to decrease the risk of internal bleeding. because if a patient does have a severe form of the virus, they will start to develop symptoms such as gastrointestinal bleeding, and they take a painkiller that increases that, then the disease becomes more significant. And the effectiveness of this, most patients who are diagnosed with yellow fever actually don't exhibit any signs or symptoms, so they will recover within 2 to 3 days, which is why yellow fever isn't as toxic as other viruses. But if it does progress, it will become really malignant. And then also most patients who do recover, they're usually treated with oral therapy and a type of painkiller. But again, the patients who have severe cases, 15% of those, about half of those will actually die, and then the other half do recover. And they're usually treated with blood transfusions to help prevent loss of blood and kidney dysfunction. And then here I have some signs and symptoms of yellow fever again. Again, we have some mild symptoms, mild to moderate symptoms that most patients will have. And then the severe cases, which do occur in cases that are left untreated, they will develop high fever, internal bleeding and shock, and then of course the most obvious, jaundice, yellow discoloration of the skin and eyes. So the impact, the treatment plan. For patients with severe symptoms, medical hospitalization is necessary. The hospital should monitor and control their fluid movement, use an IV with 0.9% saline to prevent dehydration and promote fluid replacement, and if the patient has a severe form of the disease, mechanical ventilation may be used if they have upper gastrointestinal bleeding, respiratory failure, or if the patient is completely unconscious. So, the prevention plan. The CDC does recommend a few things to help prevent the spread of yellow fever. There are a couple ones here. To use insect repellent if one is going outside. Even mosquitoes here, you have to be really careful because they do spread a lot of diseases. So always use insect repellent if one is going to go outside and to hike or into the rainforest. Wear proper clothing if again hiking to reduce mosquito bites, such as long sleeves, long pants, and long socks. To be aware of peak mosquito hours from about dusk until dawn. And then the most important, to get the yellow fever vaccine. A lot of young people do get the vaccine if they are going to be traveling to places such as Africa or South America. So that is the most important preventative measure. And then to use mosquito nets around beds to prevent entry of mosquitoes. So in patients or individuals who do not maybe have access to the yellow fever vaccine, they will have a mosquito net around their bed so the mosquitoes can't bite them whenever they're sleeping. And then lastly, we have some pictures here. We have some insect repellent, a man here who is modeling proper attire if you're going to go hiking, the dusk until dawn picture to show where the prime mosquito hours are, and then lastly, the most important, the yellow fever vaccine. That is the most important preventative measure of the yellow fever virus. And that's everything. Thank you so much.